Honored to be here. I may be the only non-interventional radiologist here, so I'm the second, actually, someone else in the back. So I actually see a lot of the truncular vascular malformations as plumbing problems, simply, but I have to say that the presentations preceding me have really deepened my understanding of these lesions, and Pat's presentation was a very good, I'm a good segue to her complete categorization because I didn't want to repeat everything. I am the chair of the scientific committee, and I have to say that Michel Wassef, who's a pathologist in France, really did the entire schema, and there was a lot of back and forth with the entire scientific committee, which, as Pat mentioned, is very multidisciplinary, as well as with the board of ISFA, in order to fine-tune the updated classification to include the new histologic information and genetic information. And I'll also mention, as a segue to Dr. Baumgartner's presentation of the Hamburg classification with the truncular versus the extratruncular. I believe a lot of the extratruncular lesions now have a future with medical management, which is very exciting, which is also new, which I won't focus on in the talks that were assigned to me here. I don't want to overdo the presentation of the current classification, but my assignment today was to focus on the lesser known vascular tumors, which perhaps the audience is not focusing a lot of their work on, but you'll see where that may be relevant, potentially relevant. So in terms of vascular tumors, clearly the most common is hemangioma of infancy, and previously, for those that see hemangiomas of infancy, that one term just meant a vascular lesion that grew postnatally, as here, wasn't present at birth, grew postnatally, untreated, would stabilize and then gradually improve. And therefore, the going lingo by a number of physicians, which oftentimes are pediatricians, is that don't worry, they're going to go away, so why bother? I think you'll be convinced after today that that's not necessarily true. And then over the years, colleagues have identified